And I see today when I walk in hospitals, more and more instances of folks in a facilities leadership position that have little or no healthcare background. I'll talk to somebody, they may have been there 6 months, but where they came from was a total different industry. As healthcare is so highly regulated, you have to build an acumen over time, certainly around regulatory compliance. I'll tell you a quick story. My first job in facilities management, again, I told you I sat down, what are all these white binders in front of me? I got 30 binders, I got NFPA manuals all over the place. And I started to feel comfortable after a couple of months of digging in. I got everything ranged by EPs. I didn't do it. The system was already there, but I'm starting to understand it. Then a fire marshal walks in, and all of a sudden I'm getting used to this language of joint commission, elements of performance, EP1, supervisory devices, and whatever. So I kind of knew my way around at a superficial level. But all of a sudden, this guy's not talking about elements of performance and EPs. He's talking about NFPA. And I'm like, so we're talking a little bit different language. And that's when I recognize, okay, you might start to get something, but it's deeper than that.
But I will say I came into this industry with absolutely no knowledge at all. I had been in a hospital once before when my brother was born. And I didn't know anything. And my biggest resource was ASHI, and the best thing I did was study for my CHFM, because it kind of told me the entire realm of things that I needed to know, because it covers such a broad variety of subjects. When I first started studying it, I didn't know anything, but just studying for it and digging into all those codes, digging into even the planning, design, and construction requirements, all the infection control. Those were things I wouldn't have known that I needed to know had I not looked at that exam. So that was extremely helpful. So if somebody's starting out, that's what I would suggest you do, is even if you're not going to take the test for a couple years, start studying for it, because it's going to tell you what areas you need to focus on.